Hello, listeners. Yamina here. Welcome to the Dr. GPCR podcast. Before we dive into this episode, we would like to take a moment and thank our Dr. GPCR Ecosystem partners for their support. Domain Therapeutics, GPCR Therapeutics, Design Pharmaceuticals, Montana Molecular, and Orion Biotechnology. We hope that you were able to join us at the Dr. GPCR Symposium on Molecular and Structural Insights in GPCR Activation. If not, you can go back and watch the recorded talks with your premium membership. Also, mark your calendar for the upcoming symposia on September 22nd on the topics of GPCRs as therapeutic targets. If you'd like to be considered as a speaker or have a speaker suggestion, please email us at hello@drgpcr.com. More information can be found in the ecosystem. If you haven't noticed yet, we've added menu buttons at the top of the page for your convenience to help you navigate the ecosystem more effectively. And now, let's dive into this episode. Hello, everyone. This is Yamina from Dr. GPCR, and this morning I'm very excited to have with me Dr. Nicolas Gilles. He presented recently, or not so recently, at the Dr. GPCR Symposium, some very interesting work, and I'm excited that we're talking today. Hi, Nicolas.
Hi, how are you?
I'm well. How are you?
It's okay, thank you.
I'm very excited to talk to you today. I remember your presentation at the previous symposium, and I thought it was very interesting. I was hoping you can start us off with a short introduction as to who you are and what do you do.
Yes, for sure. So I'm a researcher now for almost 30 years, and I'm working at in a French institution to make research focused on several topics like nuclear energy, alternative energies, biology, and nuclear for medicines. And in this context, I passed my PhD quite a long time ago, and I stay in this institute for my science.
People might be wondering, nuclear energy and GPCRs, how does that even happen? Would you please tell us a little bit more about what do you do at the institute and how is it connected to the GPCR field?
Yes, the connection to the GPCR is not so easy to understand. This is clear. In fact, when this center have been created after the Second World War, we knew, of course, already that the nuclear energy can be very dangerous for cells, for animals, for humans. So it has been created since the beginning a biologic department to understand nuclear power, radiation, and also to use it to develop nuclear treatment for cancer, for example.
Mm-hmm.
So since the beginning, biology entered in this institute, and of course the scientific thematics have evolved. And at the end of the previous century, a big research area have been developed in France called protein engineering. And at this moment in time, we were already working on animal toxins. So animal toxins are small proteins interacting with membranes protein. And so we could develop this thematic to try to understand how their small peptide interact with big membrane proteins. And after my PhD on animal toxins, active on ionic channel, because this is the main topic in animal toxin, I decided to switch to GPCR to try to develop drugs. So it is why I start to work on GPCR by the focus of animal toxin.
That is very interesting. And you mentioned that you completed your PhD a very long time ago, and that you just mentioned that you worked on animal toxins and ion channels. Did you always know you wanted to be a scientist?
No, absolutely not. In fact, I did a short study after my degrees, my high level, and I started to work on this institute as a engineer assistant. And during the first month of my work, I realized that in fact it is the boss of the lab who had the good place in the lab, and because so I decided to start school again during my work to obtain a master degree. And at this moment in time, I realized that in science, in fact, there's almost no place between engineer assistant and researcher. So I continue and I did a PhD to become a researcher and to be able to develop my science.
Oh, interesting. And as a child or as a teenager, were you more interested in, arts or biology or physics, mathematics? We've had many guests who have been interested in all sorts of topics, but science. I'm curious.
No, I was not attracted by science as we previously mentioned, but I was attracted by the scientific field, mathematics and physics and biology.
How cool. How cool is that? You never know, as a child, your interests might evolve and shift. And then you can't trace it back and say, oh, this child is gonna be, do a PhD.
Yes, this is clear. This is clear, yes.
So you mentioned switching to working on animal toxins in the context of GPCRs. When was the first time you heard about GPCRs?
During my PhD, so at the end of the previous century, my knowledge in pharmacology was very small because of my cursus, and I learned about receptors and ionic channel during my PhD, and then GPCR, and then I realized that GPCR is still a very interesting therapeutic target, the biggest class at this moment in time. We can come back to this after. And the main point for me was to start a topic which is quite different from what other people are doing. So most of the researchers working on ionic channel on animal toxins, sorry. So most of the researchers working on animal toxins work on interaction between toxins and ionic channel.
I wanted to ask because this is a quote unquote a problem for many students and many postdocs. They're always told, oh, you should pick something that's unique as a project, or you should pick something that others are not working on. In your experience, in your case, when it came to switching from ion channels to GPCRs, how did you figure out that was, well, obviously I think it was for a long time very clear that GPCRs are important drug targets. But in your case, animal toxins, how did you make the connection, or what was the state of the knowledge that made you say, oh, actually, I'm going to focus on GPCRs and toxins because this is not explored?
Once I had my PhD, just to give you some numbers, we knew around 5,000 animal toxins active on ionic channels, and let's say 5 active on GPCR. So I knew already that it is possible to find animal toxins active on GPCR. Okay, and the two classes of receptor known to be targeted by toxins were adrenergic and muscarinic receptors. So I had this information. In front of this information, another one which is very important is that out of the 14 million estimated toxin on Earth, we know 5,000. So we know nothing. And the third point was to understand that toxins active on ionic channel have been founded because the first purpose was to try to understand why some venoms are very toxic for insect or for mammal or for both. And when you are looking for toxicity, generally you identify toxins active on ionic channel because this is the easiest way to immobilize a prey or make damage on prey or predators.
Interesting. Good.
So, to my opinion, we have just a very narrow view of what are the animal toxins, because we looked only for one activity to make it simple.
Yeah. And the toxin that acted, this might be naive. Has anybody looked at the toxins that act on ion channels if they have any effect at the same time on any GPCRs? Or it is very
No,
specific?
no, in fact, it is very, very funny to see that the two words, ion channels and GPCR, don't know each other.
Wow.
Because it's, despite the fact that both are membrane proteins, it is absolutely not the same techniques to study. To make ionic channel study, you need to make electrophysiology, which is a very specific technique. And GPCR, as you know, you have to follow the second messenger or the interaction with beta-arrestin, and it's completely two different fields.
Yes. Which could be, which should be working together more because they're interdependent on each other.
Yes, but in fact, everybody work should work in more collaborative way, but it's very difficult because it is already difficult to be good in your field, and so this is the reason why I switch my scientific thematic to animal toxins active on GPCR.
How did you, when you switched, what was the first thing you did, knowing that there's, 40 million animal toxins, about 5 were known to act on GPCRs. So you're swimming in this ocean of animal toxins. How did you go about studying their action on GPCRs?
As usual, in fact, when you want to go in a new direction, you never start swimming at the middle of the ocean.
Yeah.
No, you start by what have been described first.
Yeah.
So, as I told you, snake toxins and cones toxins, cones are small gastropods living in water, have been described to act on GPCR.
Mm-hmm.
And two classes of GPCR, adrenergic and muscarinic receptors. So I start to screen new venoms on adrenergic receptor, just to stay close to what we know. Yes, exactly. And I found my first toxin, very selective, very active. It was my first patent and my first work to try to develop it as a drug candidate. It failed because many drugs were already on the market, so it was not possible to take any part of the market. Remember that animal toxins are peptide, so difficult to produce, difficult to administrate. The second toxin was also on adrenergic receptor, but another subtype. And then I switched to peptide-sensitive GPCR.
Okay.
And I selected the vasopressin type 2 receptor, expressing the kidney. And I was very lucky to find the most beautiful toxin because I'm still working on it.
How did you pick the V2R receptor out of many other receptors?
So I really tried to identify unmet medical needs, and it's not easy. We knew already that some conus toxins act on V2R as a toxin which is very close to the natural agonist, the vasopressin, and some animals make toxin which look like natural agonist. But there's vasopressin-like toxins act on other vasopressin subtype. V2R, I make a very extensive literature, and and one day I said, okay, this one seems to be linked really to unmet medical need. There was no antagonists on the market.
Mm-hmm.
And V2A is linked to two diseases, the hyponatremia syndrome and the polycystic kidney disease.
Wow, and
So,
that kept you busy for a very long time.
yes, a lot. So this is the reason why I selected the V2A. It was in 2007.
Wow.
With my colleagues, we start to screen different venoms, and in a mamba snake venoms, we find the first toxins active on V2A, what we call the mamba coatin, because it comes from a mamba snake and it had the aquaretic effect. And we were extremely lucky because the natural toxin is low nanomolar affinity. It doesn't act on 150 other GPCR. So it's extremely selective and it's absolutely not toxic. So it is funny because it comes from a very dangerous snake.
Yeah. And when you mentioned, toxins and coming from all of these dangerous animals, how do you get access to this? And this is maybe naive because for those of us who actually most of us who don't work on toxins and venoms, how do you get access to these?
So because snakes are big animals and because the mamba snakes are making a lot of trouble in Africa, you have farm breeding snakes and to collect the venom and to immunize horses to develop antisera.
Wow.
Okay, so this is the main purpose of farms breeding different venomous animals. So there's venom. It's easy to have access. You have just to buy for a few hundreds of dollars, and you have venoms and enough venoms to work with.
Wow, that's
Yes, this is
you
quite
just
easy.
order it basically.
Yes, it's quite easy. But you have to keep in mind that most of the venomous animals are really teeny.
Yeah.
And so you cannot have access to the venom. And this all is like in any field in science, snake venoms and scorpions and big tarantula venoms are well studied because you have access of venom. And most of the venomous animals we don't know at all because it's very hard to have access.
Wow. I didn't think about the size and the quantity of venom you might have access to, and the fact that you can actually just order it for your research, which is actually quite cool. So we talked a little bit about, you switching to working on GPCRs. Do you have a favorite one?
At this moment in time, of course, the V2R is my favorite one. In fact, any GPCR linked to clear unmet medical needs are my favorite one. I'm not specialized in one class of GPCR. So for the last years, I looked for toxins active on melanocortin receptor, angiotensin receptors, and others. I'm not specialized in one organ, the kidney or the heart or the breast or whatever. And so I'm just specialist, in fact, in animal toxin. And I know now more and more GPCR because it's the target of interest. So any GPCR linked to unmet medical need, it's have a lot of interest for me.
And this is very interesting. So you're basically focused on the animal toxins, and any GPCR that might come into the picture is something interesting that you think about. When was the first time when people thought about using animal toxins as drugs, targeting either ion channels or GPCRs?
The first patents are from the 80s.
Wow.
Okay, so a long time ago, because ionic channels also are very important therapeutic targets.
Yes.
Very important. for a reason that I don't understand why, or I don't have a clear reason, idea, is why there's so little good drug active on ionic channels, as you have so many good ones working on GPCR.
Yeah.
So maybe one of the reasons is that GPCR has been made to bind a ligand, while ionic channel, at least the voltage gated ionic channels, are not ligand gate channel. So maybe this is the reason. Maybe also because the only good ligands for ionic channels come from animal toxins. They're peptide. Pharmaceutical industries don't like peptide, even if they say that they are starting to work with peptide, but most of the time they tell you develop a small molecule, please. So maybe all these dimensions make ionic channel not less important, but less develop therapeutic targets. So the first patent was in the 80s, and there's a lot of patents protecting toxin. But to tell you the truth, there's only two toxins on the market really used, which is very small. The first one is the beta, which GLP-1 agonist for type 2 diabetes, which come from the saliva of a which a lizard, the Gila monster. And the second one is a Prialt, which is a painkiller from a cone snail, and it's very hard to use it.
Wow.
So there's not a lot. There's few other on the market, but almost never used.
Interesting. I find this very interesting that you go into using toxins and peptides derived from toxins to act on GPCRs or ion channels for a therapeutic purpose. I think it's a really cool idea, but at the same time, I feel like it's nature's way of telling us, and at the same time, quite a lot, but we don't know nearly enough. Do you think when it comes to using toxins, well, I know we're talking about GPCRs, but I'm really interested in ion channels. Do you think it's the fact that there aren't many drugs that act on ion channels derived from toxins? Do you think it's due to the fact that we don't have enough tools to run screens or better understand these actions, or is it just a risk averseness when it comes to peptides versus small molecules? So obviously, a small molecule, you just pop it. A peptide, you have to inject it, and it has a half-life, and it's a delivery system that's completely different.
It's difficult to answer. Probably, as always, the two dimensions are important. Also, maybe the culture of the drug development, the protection of molecules, it's much more developed in the GPCR field than the ionic channel field.
Okay.
Many patents which have been deposited, we are not exploited.
Wow.
So of course the peptide natures of a potent drug candidate is a real break in the development.
Yeah.
Much less now than 30 years ago, because the chemical synthesis is much less expensive than before, and because again pharma are more open for, let's say, biologic in very general term.
Yeah.
But the cultures of the people working on ionic channels are much more fundamental question, and maybe not enough not enough aware of the potent application. Worldly changing, of course, because now there's a lot of labs working on the couple animal toxin ion channels, thinking about patent protection and drug development.
Mm-hmm. Oh, interesting. I find this really fascinating with animal. Until I honestly, I never thought about it until you and I started exchanging emails, and then you came and gave your talk at the symposium. And that's when a world of toxins opened up, at least for me. So for the V2R research that you've been conducting, can you tell us a little bit more about, how when you started, what was known in the context of V2R function in response to toxins, and where we are today?
Okay, so the V2R is almost exclusively expressed in the kidney, and it's regulate water homeostasis. So when your body need water, the hypophyse secrete the vasopressin that will activate the V2R, and the water will pass from urine to blood. And so you concentrate your urine to keep water inside. And the blockage of the receptors is linked to two medical needs, so the hyponatremia and the polycystic kidney disease. So hyponatremia is a syndrome known since a lot of time. In fact, is when your blood sodium is below 135 millimolar.
Okay.
And there's a lot of etiology for this syndrome. And one of the most common point is conditions is that your body secretes too much vasopressin. For example, you have some cancer which have auto and paracrine functions which can secrete vasopressin by itself. And you have also central nervous disorders. You have many things. The conclusion is that you have too much vasopressin in your blood, so you concentrate too much your urine, and you dilute your blood to make it clear. Yeah. And so one of the way to restore the good natremia is to block the V2R, which will induce loss of water without loss of electrolyte. So it is why we call this effect an aquatic effect, which is different than the diuretic effect. Yeah. Because diuretic effect, you lose water and salt.
Yeah.
Okay, and there's one, and it is why the many pharmaceutical industries in the 80s and 90s try to develop small molecule blocking the V2R, which are called the vaptans. And only one reached the market, the tolvaptan. And it is used with many concern because it has quite big problem of hepatotoxicity and drug-drug interaction.
Interesting.
So it's not used too much. The second pathology, it's the polycystic kidney disease. It's a group of pathologies, genetic, where kidney, where you have a lot of cysts growing on kidney. And more you have cysts, less kidney work, and you lose your kidney functions, and patients have to go to dialysis or transplantation, and of course, also they die from this disease. And at the beginning of this century, it has been established a link between the blockage of the V2R and the blockage of a progression of a cyst. In fact, the polycystic kidney disease are ciliopathy. You have on this kind of a cell a cilia which is stretched by urine flow and participate to the control of the urine concentration. And in this pathological condition, the cilia work less, and the cyclic AMP become pro-proliferative. And the cyclic AMP is mostly in this kind of cell, mostly due to the activation of the V2R. So once you block the V2R, you reduce the cyclic AMP concentration and you reduce cyst progression.
Interesting. This is very, very interesting. You'd think, I'm just thinking about it and thinking, GPCR still amaze me.
Yes, this is clear. This is clear. And the Japanese industry, Otsuka Pharma,
Mhm.
which developed the tolvaptan for hyponatremia, developed also the tolvaptan for the autosomal dominant form of the polycystic kidney disease.
Yeah.
And the tolvaptan for the PKD reached the market in 2014.
Wow. And so there's one drug.
Yeah, and it's one drug with the same concern, hepatotoxicity, drug-drug interaction. So more or less 80 to 90% of patients are waiting for a good drug because they are not treated at all.
Oh, wow. That's a really high demand
Yes,
market on that end.
even if the numbers of patients is not high, these conditions affect around 12 millions of people on the planet.
Wow.
So it is the reason why I select the V2R.
Mhm.
And as I said, I was extremely lucky. We were extremely lucky to find a very nice peptide, very active, almost not toxic. And so we study it a lot. We know how this toxin interacts with the V2R. We know that it's extremely selective by in vitro test and also by in vivo test because we can draft zirconium on the toxin.
Yeah.
The zirconium 89, which is a PET imager.
Mhm.
So the type is the tomography by position emission. And we could demonstrate on mice that only kidney were labeled, no other organs. And we validate, of course, this toxin on the hyponatremia and PKD models, mice and rat models.
Wow. And then what's next?
Next. So after something like 8-9 years of work on the toxin coming from the venom, we optimized the toxin. We reduce the risk of immunogenicity and we improve its affinity. So it's what we call the hit to lead optimization step. And we generate what we call now the MQ232.
Mhm.
Because it was the 232 30 seconds variant of toxin we produced and we studied. So it's quite a
lot of
lot of variants, knowing that the peptide is 57 residues. So it's a long peptide with 3 disulfide bridges. It represents a huge amount of synthesis. And this lead have also been validated in animals, in pig, in rat, in mice. And a few months ago, I created with others a startup, the V4Cure, to take in charge the preclinical development and then the clinical development of this MQ232, first in hyponatremia and then in polycystic kidney disease. So this is the next point for this molecule.
And anyone listening, if you feel like having a conversation or invest or have a chat about the data, Nicolas is the person to talk to. I remember you
Yes,
mentioned this.
and we are looking for funds, of course,
Yes.
on the seed money at this moment in time. So the minimal investment is 10,000 euros, which is not quite a lot.
No.
For people who have a lot of money.
Of course, yes.
And a lot of costs. And in 80 months, we'll start Series A to go to the phase 1 and then B phase to B series to go to the phase 2.
Yeah.
The plan after is to sell the company.
Okay. That's the exit plan.
This is the business plan of a startup, which is a very classical business plan.
Yes, yes. And are you completely focused on this molecule and V2R and the startup, or do you have other projects in the lab running in parallel?
No, we have other part of work, of course, because now this story will be more a private, a business story than a
Yes.
scientific story, even if we still have things to do. But the second, I'm still working on the MQ232 to develop other tools, because in fact it's the only molecules able to label the V2R in vivo. So we can develop tools and try to better understand the V2R, its localizations, and many other things. So this is part of the second. This is still on the same molecules, and I'm running screening on other receptor to try to find another beautiful toxin. As I told you, few years ago we tested the melanocortin type 4 receptor, which is expressed in the brain, which is very important for the energy homeostasis, and which is linked with or obesity or anorexia. Unfortunately, the toxin we found were not active in vivo. So the story is finished for this receptor. And we also start to work on angiotensin receptor because the renin-angiotensin system is implied more than one GPCR, more than the only angiotensin 1 receptor, but you have also the angiotensin 2 receptor, the MRGD receptor, the MAS receptor, all four are GPCR. And on the three last, we don't have a lot of tools to work and a lot of drug, of course, not drug at all. And so we are trying to find molecules on the receptor.
So interesting. You mentioned for the V2R, you mentioned the molecule, the peptide localizing only to the kidney. I wonder if, I don't know if it would be useful to think about it other than the therapeutic aspect, but also as a, I'll spit it out in a second, a diagnostic tool. You know, I don't know. I'm wondering if, since it only localizes, are there any variations of the V2R expression in the kidney in certain diseases?
Yes, this is a very interesting point, and I'm trying to see if the technique of PET imaging, which give you a very precise design of the kidney, can be useful in the polycystic kidney disease, where your kidney increasing. So of course you have MRI, which work quite well, but with the MQ232, what we will be able to detect is let's say the quantity of V2R still accessible on kidney with a lot of cysts. So I'm trying to see this. It's quite difficult to make a tape imaging on the PC on mice model of PKD. We have to do that, and we have also to do it at different moment of time to see the evolution of the kidney and to make it by MRI in parallel and to compare if we have additional information.
Yeah, I think it could be a really interesting tool to follow the progression, or maybe that would allow also physicians to determine what's the dosage of the drug to get, or
yes, the amount of the drug is a good point, but also when the kidney will start to decline.
Exactly.
The loss of function, it's not. It's a little bit related to the size of the kidney, but the relationship between the two dimensions is not so clear and not so precise. Maybe with another technique, we'll be more precise to anticipate the loss of function of the kidney, maybe.
Wow. So you have a fully, it sounds like, you're doing a lot of research, but at the same time, you have definitely the interest of going from the bench to bedside. And you have this pipelines
Exactly.
developed in the lab, which I
Yes.
think is really fantastic.
Yeah, thank you. It's exactly what I wanted to do 25 years ago. And thanks to my colleagues and to all the staff we are in the lab able to manipulate venoms, to make screening, to make chemical synthesis. And now with the startup, go to the bedside if everything went right. Yes.
Yeah, fantastic. I have a couple of more questions. We talked a little bit about the lack of tools or in order to understand, or not necessarily the lack of tools, but a need for additional tools to get a more holistic vision as to how these toxins and venoms act on GPCRs or even ion channels. In your opinion, if you had a magic wand, then you can come up with a really cool tool that would help advance your project and make it, half as short or half as long as it was. I remember you mentioning during your talk that your journey has been, it's 25 years of research to get you to where you are. What would that tool look like?
So there's two ways to answer. The best tool I am thinking about will be to try to identify toxins on orphan GPCR.
Yeah.
At this moment in time, I need a readout. And this is, of course, limiting a lot the GPCR on which I can work on. And to develop a direct way to identify toxins binding on GPCR, and then to see after if they will act as agonist, antagonist, or whatever, no matter, but to a direct tool to fish the toxins binding on a certain GPCR. I am working on this. It's extremely difficult. It's extremely difficult because currently we need to stabilize the GPCR, and you never know if after reconstitution your GPCR is still on the on the right shape,
Yep.
on the right conformation, and it's still a very difficult and complex step. And after you have to develop a way to identify the toxin binding directly on the GPCR. And we are working with venom, and venoms are composed of hundreds of toxins.
Yeah.
So this is very difficult to deconvolute.
Yeah.
I have also synthetic bond, thanks to a big parent project I managed a few years ago. But then you have to test toxin by one, which is a very long process. So this will be my best tool ever to switch to orphan GPCR, to switch to odorant GPCR also. I'm almost sure that it will be they can be also very interesting to study.
Yeah, I think olfactory GPCRs are really, really interesting, and there's
yes, and they are not considered as druggable GPCR. That might be wrong because I'm sure that there are much more other function than just having pleasure when you drink or eat something good.
No, I agree. I agree. I think we just don't know enough, and we
Yes.
just don't have the tools yet to study them, although I think we're getting much better at it. Speaking of drugs and drugging, the answer to this question is always yes, but I'm more interested into the why yes. So do you think GPCRs are still good drug targets?
Yes.
And I think the whole conversation we just had explains why these are good drug targets. Anything you'd like to add?
No, I have no more information than the specialist in this field who said that the proportion of the druggable GPCR really exploited are between 20 and 30%.
Yeah.
So this is part of the answer. Even if there's a lot of GPCR which are expressed everywhere in the body and much probably not good drugs with the vision we have now of the drug, meaning that you distribute the drug all over the body by oral way or parenteral way, whatever. But yes, of course, GPCR are still very important drug candidate. And of course, you know that the dogma of one GPCR, one signaling pathway is dead since long time now.
Yeah.
And the biased ligands will probably be the next challenge.
Yeah. I was at the Gordon conference in Switzerland, and I was talking to someone, and the person, I'm not going to say who they are, but they were wondering about, bias signaling in vivo, and is it really happening? Because we've been studying, one receptor in a hex cell or in a system, and we're looking at bias signaling within that system. But in reality, all of these GPCRs can be co-expressed in the same cell, and then you have the whole organ, and then you have their effect on the entire body. So I think the effects are a sum of the function of all of these GPCRs working together. And I'm just mentioning GPCRs, but there's other obviously signaling proteins that are important. So I'm wondering, and the person I thought about, is bias signaling a true, happening in physiological context?
Yes.
I thought it was a great thing to think about, and try and think about bias signaling in the context of a native cell that expresses all sorts of GPCRs, and that's exposed to all sorts of ligands as well at the same time.
Sure, we'll succeed.
Much more work to be done, for sure.
For sure, no doubt.
All right, last segment of our conversation. What would be the top 3 aha moments that influence your career trajectory? It doesn't have to be scientific. It's up to you.
It will be.
That's good.
No, the first one is when as I told you, I start as an engineer assistant. I was working on expression of protein by bacteria, and I switched to a completely new field for me during my PhD, which is the animal toxin, as you understood, active on ionic channel. So this is my first quite important moment for me. I learn what is science, what it is to define a good scientific questions, and why we want to answer to it, and what we have to develop to be able to answer it as much as we can.
Yeah.
The second moment really was the discovery of the Mamba creatine. Not when I discovered it, but let's say 3-4 years after, when I realized, in fact, that we have a perfect drug candidate.
Yeah.
And the third moment is now, really, because with the startup, it gives you, of course, a lot of work to do in addition of the work in the lab. But it's for me the real important step, because we have a chance to help patient.
Yeah.
So the fourth will be when the drug will be on the market.
Yeah.
If we are extremely lucky, and if the story go until the end.
Yeah. No, absolutely. Thank you for that. I love it. Any advice for junior scientists who want to contribute to the field, either of the field of venoms or GPCRs or ion channels? It doesn't matter.
No matter
to science.
the field. No matter the field. The only things I'm asking always is, at which question do you want to answer? Because many times, young or less young student or say, oh, I will do that, it's nice. Okay, which question you want to answer, and why you want to answer this question? And if people, it's very difficult, because you need a lot of time to maturate your thinking, to maturate the question, to identify the right question. And we, for example, I start really to know how to work 10 years ago. So it takes a lot of time, at least for me, it took a lot of time. And in parallel, when you have PhD students, there are so many things to do. But it's very difficult to stop and to sit down and to think. But this is my only advice I will give. Try always to know exactly why you want to answer this question and what is the question you want to answer.
I love it. And you mentioned, learning how to work. I think that's one of the things that we are not taught in school is learning how we learn, because each person learns differently, and how to use your strengths to your advantage, to advance, your career, your knowledge. And also, I think even in during the PhD, at least in my case, and even after that, being taught or being told, actually working in the lab is not everything. You have to stop and you have to take the time to read, to identify questions. You have to, it's not about hard work, it's about smart work in the long term, because at least I had the tendency of spending too much time in the lab and avoiding the reading part, the writing part, and now I realize that's a mistake. It is, but it's difficult because you're on that hype train, and that's the natural tendency. But had someone told me, hey, stop it, you should have one day where you don't do experiments, where you actually take the time to read, take the time to get away from that train, it would have
And to
helped me
understand
develop.
your result.
Exactly.
And to understand your result. Yes.
Exactly. Last question. If and when you have job openings in your team, where can people find you other than our website?
This is a difficult question, in fact, because I'm not using almost not LinkedIn. I'm on LinkedIn, so if I have a job open, it will be on this social. But I don't use it a lot. I'm not very good in that, and in fact, I don't know really much.
Well, maybe people can email you and they will find.
Yes, by email is very nice because this at least I manage. And
That's good. That's important, I think, nowadays. At
at
least
least,
email.
at least. But I'm not good in all the tools we have now, like LinkedIn, Twitter, and things like that.
But at least people can find you, and they can, the university or the institute website is also
Yes,
a source.
I think only my name, toxins and France. It's okay. You fall on my on all my. You can contact me. It's quite easy. V4Cure now will have a lot of visibility also.
Great.
So all this make more communication, and it is what we are doing, of course, together today, making more
Yes,
communication.
absolutely. Nicolas, thank you so much for your time today.
Thank you for you. It was nice time and pleasant moment.
Thank you for joining us and listening to this Dr. GPCR podcast episode. We would like to thank our guest. We also want to say thank you to our Dr. GPCR team members, Attila, Ines, Montserrat, Ivana, Andreina, Balint, and Julia. A huge thank you to our ecosystem partners as well: Domain Therapeutics, GPCR Therapeutics, Design Pharmaceuticals, Montana Molecular, and Orion Biotechnology. You can connect with our partners directly in the ecosystem, so don't forget to join us today. Please subscribe to the Dr. GPCR newsletter, find us on YouTube, and if you like our podcast, leave us a 5-star review on Apple Podcast. You can also leave us a testimonial at drgpcr.com/testimonials. Another great way to support us is to share your favorite Dr. GPCR program with your network and colleagues. With any questions or suggestions, feel free to email us at any time at hello@drgpcr.com. Until next time, stay safe.